what are the human services? Let me just backtrack a little bit. Charity has always existed. It's part of the tradition in the Judeo-Christian and other religions background. While we can say that for a large part of our history, government played not a very active role and private sectors or private people managed charities, after the New Deal was enacted by Franklin D. Roosevelt, government started taking a much more active participation in government. New York City has had a long history of helping the poor from the days of the colony onto the present. Government had done a lot of the services for many years. As you can see, I'm not a youngster. And when I first started in government almost 40 years ago, government was still delivering the bulk of the services. HRA was still delivering the bulk of the human services and health services, if you will. And I would say somewhere around the end of the 70s, beginning of the 80s, there was a profound transformation in government where we started contracting out services to not-for-profits. There were not-for-profits, but it was not as robust a sector as it is today. And service by service, we saw a progressive contracting out of those services. And instead of government workers doing the service, we now had not-for-profits delivering those services. I can tell you examples like home care, where we have upwards of thousands and thousands of cases. Those are now home attendants in the private sector. It used to be HRA workers. Homelessness, there used to be city-run shelters that were contracted out at the beginning of the 90s. So service by service, you saw how everything was beginning to be done by other than government workers. Interesting, because we're providing a huge array of services. We're providing elder care, child care, domestic violence, employment services, disaster relief, mental health, and you have an enormous workforce that has grown around the delivery of these services. Government now spends $6.5 billion in contracts, right? Big number. And it's about 80 to 90% of most of the not-for-profits out there. Not all of them. We were just talking to the next speaker, Alan Van Capel, and his organization, which is a wonderful settlement house, has a much lower level of government funding, but that's not the usual. The city agencies that do the most contracting out are ACS, which stands for the Agency for Children's Services, DFTA, Department for the Aging. It used to be DOA, but it sounded like too bad. They didn't arrival, so they changed it for Department for the Aging. Homeless Services, Department of Education, Department of Mental Health and Mental Hygiene. So you have a wide array of agencies that now what they do is essentially they procure services. And what do I mean by that? They do an RFP, request for proposals, and they adjudicate the funds, and then they proceed to monitor to see the agencies are doing the right thing. What are some of the myths in this sector? Most people think that the funding is mostly philanthropic. No, most agencies are funded by government funding. Philanthropy will contribute somewhere between 15–20% of the cost of the service, but the main funder continues to be government. Mostly run by volunteers. Wrong. There's a huge workforce, 330,000 people in New York State that work in this sector, as big as the aviation industry. Not as well paid, may I say. And it is a really substantial industry. And it's woefully underpaid and woefully undertrained and with tremendous amount of responsibility. And it's something that, it's a real challenge. So what is the relationship between government and the not-for-profit sector that delivers the services? Are they partners or are they vendors? Well, they're partners when it suits government to call them partners, and they're vendors when it suits government to be vendors. And what do I mean by that? Partnership means that you have to be together with somebody and making decisions jointly, and you have to create policy together, and you have to be thoughtful about how you do service delivery. And that doesn't necessarily happen, or happens very rarely. Government continues to make the major decisions and then participates it to the not-for-profit sector. Insofar as that happens, their vendors, as the people that they buy widgets from. However, when they really need somebody to go and defend their policies, all of a sudden they become partners. And all of a sudden they're there to talk about what really happens and why it's happening and how we're all in it together. So it's a very interesting relationship that should be rethought, because I think that the not-for-profit sector could really, really contribute much more to having much more sane policies. Remember, these are the people who are on the ground. These are the people who really touch the clients. When I was commissioner of children's services, actually, I used to say that there were 17 levels between me and the caseworker. So my assessment of reality was tenuous at best. And I think to make policy, you have to know who you're making it for. So what is the contract process? It's about the most convoluted, difficult, incredibly unfathomable system. It takes about between minimally a year to 2 years from the time that the commissioner decides to have a contract to the time that they can actually have the money flowing. And you can imagine how much changes between that initial desire to what happens when you can actually flow the money. So it's really, really problematic. Has things like prior experience doesn't count. So it's supposed to level the playing field. It has a number of quirks that were added just to supposedly prevent favoritism and prevent people from having the same people having the contracts all the time, but it just makes the system very difficult to navigate and very convoluted. Another thing that is really ripe for change. So what are the real challenges in the system? Well, a lot of not-for-profits are in the distressed state. 20% of them are not solvent anymore. What do I mean by that? Well, they have what I used to call a rolling deficit. So I worked at United Way for a number of years, and people would come to me and tell me that they have a real cash flow problem. And I would sit with them, and I would look at their books, and essentially they didn't have a cash flow problem. They really had a big deficit that they were paying off, with this month's advance, they would pay the next month advance, and at the end of the year, they ended up with $200,000-300,000 in the red, but they paid that with the advance they would get for the next contract year. And so this rolling deficit was masked until the point where it accumulated, and then one day they had a $3 million deficit and they had to fold, or they had to merge, or they were in a horrendous situation, not paying vendors, not missing payrolls, all kinds of things like that. So many of them are insolvent at that level. Very few have reserves. Most of them operate on credit lines, which, of course, the interest is not reimbursed by government. They have very thin operating margins. Most of them are just essentially not even getting close to pay for the full cost. The staff turnover is huge, and it used to be that the competition for staff was between not-for-profits. Government pays much better, and whenever they expand the program in one of the agencies, they take the bulk of the well-paid, well-trained employees of the not-for-profit. And there's a growing demand for services, so that you have to scale things very quickly. And the main problem is that government takes somewhere between 6 months to a year to pay you. So unless you have a really large amount of money in the bank, or you have a very large credit line, you have to fund 6 months of services without being paid. And it's impossible for a small not-for-profit to do that. And many of them have gone into debt just trying to do that. So it's a real, real problem. So what are we going to do to change the playing field? Well, there's a big effort to try to tie the human services sector with the health sector. Why? We're moving into value-based payment in the health sector. The health sector, needless to say, is much better funded, for sure. And the idea is that many of the outcomes that they're looking for are outcomes that could be only enhanced and really make possible because of the integration of both services. What does that mean? Well, you have to prevent rehospitalization. You have an 83-year-old patient, just had a bad pneumonia, gets sent home. Nobody went to their home to look and see if the refrigerator had food. Nobody went to the pharmacy to get their meds. Nobody's making sure that she does take her meds. So the outcome is that 5 days later, she's back in the hospital. So if you had a caseworker, if you had a social services agency involved, that could be prevented and the outcomes would be much better. So that's the general kind of thinking, and that's what we're looking for. And we're wanting to integrate into that sector as well. So that's pretty much the long and the short of it. There's a lot of challenges. It's a really good sector. If you want to make a living, don't go there. But if you want to have a meaningful life, do. It is, at the end of the day, it's not how many toys you accumulated, but how you feel about yourself and what you've done. And this is a unique place to make your mark. I feel privileged that I've spent all of my career, essentially, in health and human services, and there's nothing like it. It's a unique opportunity, and it's a great calling. Thank you.